Statements will be included in the record. Chair now recognizes the gentlelady from Wyoming to offer an amendment in the nature of a substitute.
Mr. Chairman, I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute.
Without objection, the amendment in the nature of a substitute will be considered as read and shall be considered base text for the purpose of amendment. The chair now recognizes the gentlelady from Wyoming to explain the amendment.
Thank you, Mr. Chair. This amendment clarifies the definition in the health of the minor section of the bill, and it also clarifies that necessary medical procedures are not defined as mutilation. I urge support for my amendment, and I yield back.
I thank the gentlelady from Wyoming. Who seeks recognition? The gentleman from New York.
Thank you, Mr. Chairman. Move to strike the last word.
The gentleman is recognized.
Thank you, Mr. Chairman. Mr. Chairman, this bill is a disgrace in a long line of disgraces. It outlaws gender-affirming care. Gender-affirming care we know to be life-saving procedures. The suicide rate of transgender teenagers who are denied this care is sky high. We started out with the president's executive order denying the existence of transgender people. They don't exist, but they obviously exist enough to be kicked out of the military, not categorized in male. Now, if you say there are only two sexes, males and females, then the males in the military who are transgender should have been declared males and kept in the military. Instead, we kick them out. That doesn't make sense. It's just an exercise in prejudice. And who are we to dictate to families and doctors as to the proper medical care for their teenagers? We know that the suicide rate of trans teenagers who don't get gender-affirming care is very high. It is and this bill would make it a crime to properly treat transgender people. The medical societies recognize that transgender as a category. We know that there are not just two sexes, male and female. For decades, it was criminal to be gay, to be homosexual, to be lesbian. And people were subject to blackmail for that. Just watch The Manchurian Candidate, good movie. We know better than that now. So why don't we know better than that about transgender people too? We have to open our eyes and see what's in front of us. Enabling families, troubled families, to go to their doctor and say what's wrong. And the diagnosis is that this kid is trans and needs gender-affirming care. If they decide to do it, who are we to tell them not to? Are we a dictatorship? We dictate to families? That's what this bill would do. This bill is a disgrace. It is Big Brother. The Republican Party supposedly is the party of small government. And here it is saying that Big Brother knows better than the family and the family doctor. That is not right. And we shouldn't pass this bill. And I'll yield to the gentleman, to the Mr. Raskin.
And I thank the distinguished gentleman from New York. I wanted to enter for the record a unanimous consent request. This comes from the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Osteopathic Association, and American Psychiatric Association, titled Leading Physician Groups Oppose Infringements on Medical Care Patient-Physician Relationship, dated May 1, 2025. And I want to just quote a paragraph. Our organizations have consistently opposed any legislation, regulation, or executive action that interferes in the confidential relationship between a patient and their physician or undermines the provision of evidence-based standards of patient care and physician training and education. Patients must be able to discuss health issues with their trusted physician to determine together what care is best for them. They make a very powerful argument against what Marjorie Taylor Greene wants to do in this bill. And I must say, Mr. Chairman, in requesting UC, I trust the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of OBGYNs, the American College of Physicians, the American Osteopathic Association, American Psychiatric Association, than I would trust, before I would trust Congresswoman Marjorie Taylor Greene.
Without objection or
reclaiming my
surprise.
time. The gentleman has recited the list of just about every medical society in the United States. And this committee, through this bill, proposes to execute our judgment, a bunch of politicians, over all the medical professionals, over all the societies representing medical professionals in this country. If it weren't for the fact that doing so would hurt many people, would cause many suicides, this would be laughable. Mr. Chairman, I yield back.
Who seeks recognition? The gentlelady from Wyoming.
I can understand why there are some in the medical field that support these kinds of procedures. They're huge moneymaker opportunities. Recently discovered video from 2018 revealed a Vanderbilt University Medical Center doctor touting the pediatric gender-affirming procedures are, quote, huge moneymakers for hospitals, and a staffer saying anyone with a religious objection should quit. The video further featured a doctor hyping the profits hospitals can make from performing medically unnecessary double mastectomies on young girls. Such a vile procedure is widely referred to as top surgery in the contemporary language of transgender ideology. The fact is, a growing number of experts in Europe and elsewhere are proposing that there is limited existing evidence that supports gender-affirming treatments in children with gender dysphoria. For example, the National Health Services of England and the Swedish Agency for Health Technology Assessment and Assessment of Social Services conducted 2 recent systematic reviews to assess the evidence of the effectiveness of hormone therapy, puberty blockers, and gender reassignment surgeries in adolescents with gender dysphoria. The 2021 and 2022 studies determined that, quote, the scientific evidence is insufficient, end quote, to accurately evaluate the effects of these treatments in minors, though both studies concluded that there is some support to suggest that the hormone given to delay puberty, GnRH, may inhibit normal bone development in children. In fact, what we know is that this particular drug carries risks of significant harms, including infertility, sterility, sexual dysfunction, impaired bone density accrual, adverse cognitive impacts, cardiovascular disease and metabolic disorders, psychiatric disorders, surgical complications, and regret. So yes, it makes sense for those some in the medical field to pursue this because, as they've indicated themselves, as they've admitted, they can make massive amounts of money by undertaking these absolutely brutal type of treatments on minors, no less. And what do I mean by the brutal types of treatments? I'll read some of them to you. It's not just, quote, top surgery that can make the hospitals money. These doctors shockingly boasted about lucrative, quote, bottom surgeries. What an interesting euphemism we have here. And promoted the money to be made on phalloplasties performed on girls. These, quote, bottom surgeries for girls nonsensically claim to help masculinize gender affirmation and involve numerous high-risk procedures, including creating the penis, lengthening the urethra so that a biological female is able to stand to urinate, creating the tip or glands of the penis, creating a scrotum, removing the vagina, uterus, and ovaries, placing erectile and testicular implants, and skin grafting from the donor tissue site. Isn't it nice that they refer to this as, quote, bottom surgery? When I talk about this as being barbaric, I think that's actually an understatement. And I can see that in a couple of years, we're going to look back on this period of time, and we're going to be absolutely horrified that we allowed people to do this to our children, that we allowed them to make these decisions for children so that they could have these kinds of surgeries and medical intervention. So yes, it is not surprising to me that you have some in the medical field that want to continue making money. And the younger the patient that they can bring in, the more money that they can make. Because once you start down this road, you will be a lifetime medical patient, both in terms of the psychiatric care that will be necessary, as well as the pharmaceutical intervention that will be necessary, and the ongoing surgeries that will be necessary, in addition to, as I've indicated, having problems with cardiovascular disease and metabolic disorders. With that, Mr. Roy, I will yield the remainder of my time back to you.
With that, I'll now recognize Ms. Garcia. Okay, Mr. Johnston.
Thank you, Mr. Chairman. I rise in strong opposition to this bill. I strongly oppose this bill because it's an extreme attack on parents, on doctors, on science, on freedom, on liberty. This bill would throw doctors in prison for providing medically necessary care that is supported by every major medical and mental health association in the United States of America, including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association, among others. And not only that, this bill would throw parents in jail if they help their child access evidence-based treatments from a medical professional. When a child is suffering and needs medical care, I want them to get the treatment that their parents, and their doctor believe is best. There's no space in that exam room for a MAGA Republican politician who wants to deny appropriate medical care from your kid out of either cruelty, ignorance, or both. This bill shows Republicans' hypocrisy. It allows puberty blockers and hormone therapy for cisgender youth, just not for transgender youth. That's because Republicans want to target and demonize trans kids. And that targeting has real consequences because gender-affirming care has been shown to decrease the dramatically high rates of suicide and depression for transgender and gender-diverse youth. We need to be giving kids the tools to thrive, not taking away their health care as a political ploy. I was proud to join an amicus brief in the pending case of United States v. Scrimetti, which highlights the role animosity has played in legislation banning medically necessary care for transgender youth, and urging the Supreme Court to strike down the Tennessee law at issue in the case. Because this bill ignores science, puts young people's lives at risk, and criminalizes doctors for providing appropriate care, I urge my colleagues to oppose this bill, and I yield back.
Gentleman yields back. Is there further discussion? Mr. Orton.
Thank you, Mr. Chairman. Since my first week in Congress, I've been calling for federal action to dismantle the transgender industrial complex. One essential step is defunding sex trade altering treatments on minors. During the Constitution Subcommittee's hearing on Congressman Green's bill, I spoke about the costly sex-altering treatments that are being paid for in some states by the Medicaid program. I led a letter to CMS trying to quantify how much U.S. taxpayers were spending on this grisly activity, but pinning down that number is difficult because of the rampant fraud and abuse in billing and coding for these procedures. For instance, these transgender clinics billing for precocious puberty or hypogonadism, when really they are using those drugs for gender transition. It is essential that we preserve the language in the House passed one big beautiful bill that defunds mutilating and sterilizing sex trait altering treatments in Medicaid. Our Senate colleagues must preserve that language. As medical doctors, we take an oath to do no harm. There is absolutely nothing evidence-based about chemical castration or genital mutilation of children. The Dutch protocol and the WPATH guidelines are garbage. 3 systematic reviews in the UK, the US, and Sweden have refuted and shown the utter scientific nonsense embodied in the Dutch protocol, basically the protocol that's being cited by my Democrat colleagues today. The reconciliation bill reflects the thrust of one of the first bills I introduced when I came into Congress, H.R. 2387, the No Harm Act, along with which contains the defunding of transgender mutilation, as well as conscience protections and a private right of action for those harmed by this grisly industry. Over the past few years, so-called doctors working in pediatric transgender clinics have prescribed medicines or done procedures they know will permanently sterilize children and leave them with irreversible psychological and physical damage. This is done in service of their poisonous gender ideology. They also exploit vulnerable children and young adults, often those suffering from anxiety, depression, autism spectrum disorder, or are victims of domestic violence. They promise these poor young people that their problems will go away and they will be happy if only they embrace gender ideology and undergo gender transition. These so-called doctors do this in service of their sick ideology, and as one of them put it, because the procedures are big money makers. The No Harm Act codifies President Trump's day one executive order and protects taxpayers from being forced to subsidize the abuse of the vulnerable. Another federal solution, of course, is before us today. This is to hold the quack doctors accountable for performing these horrific treatments on minors. Congressman Green's bill does so by instituting criminal penalties on anyone who performs sex trade altering treatments on minors. This so-called gender-affirming care is clearly child abuse. In 2021, 4,000 Americans aged 6 to 17 began cross-sex hormone treatment for gender dysphoria. Most of those 4,000 children didn't even know at the time they were signing up for a lifetime of fertility issues and other serious health problems. If a child takes puberty blockers before beginning hormone therapy, they will not develop gonadal tissue or gametes, resulting in permanent loss of reproductive capacity. We do not even let children get their ears pierced without better informed consent than this. There is also a long list of side effects in addition to infertility. I'm proud to support the Protect Children's Innocence Act of 2025, and I yield back.
Gentleman yields back. Is there further discussion? Ms. Jaya.
Thank you, Mr. Chairman.
Sorry, Mr. Garcia.
Thank you, Mr. Chairman. I move to strike the last word.
The gentleman is recognized under the 5-minute act. He doesn't need to strike the last word.
Thank you. I join the Democratic colleagues in strongly opposing the criminalization of gender-affirming health care for minors. This bill is a shocking overreach, even for a party that does nothing else except overreach. It ignores science, it endangers young people, and criminalizes doctors for doing their job. The reality is that every major medical and mental health association, as has been shared, in the country supports age-appropriate, gender-affirming care for transgender people. And like other kinds of health care, Congress should not be in the business of dictating medical decisions. And far from protecting young people, this bill only continues the Republican Party's ongoing war against the most vulnerable communities in our country. Criminalizing gender-affirming care will only stigmatize and endanger the lives of young people who should be making sensitive medical decisions in consultation with their medical providers and parents or guardians, not with Marjorie Taylor Greene. But this outcome isn't a coincidence. It's exactly what Republicans want to do. As they have done in states around the country, Republicans pretend to be protecting children when they're just punishing medical providers, caregivers, and the children themselves. Let's take a step back and just think about how absurd it is to be prioritizing a bill like this right now. Trump has tanked the economy, declared a war on immigrants, repeatedly violated the Constitution, and directed Republicans in Congress to destroy Medicaid, food assistance, and Pell Grants, to give hundreds of billions of dollars to ICE and the richest people in the country. Instead of even pretending to defend liberty, freedom, and small government, Republicans are rushing to embrace deportations of U.S. citizen children with cancer, the militarization of our communities, with violent suppression of speech and dissent, and the persecution of the most vulnerable amongst us. And it's only going to work if we allow it to. In this moment of authoritarian overreach, people across the country must stand together in solidarity. We must reject this administration's civil rights violations against people of all backgrounds. We must not fall for the trap and believe that the source of our problems is trans people, immigrants, and young people. Because the real problem is billionaires and politicians who are happy to trample on the Constitution and make a quick buck off of it and the backs of the working class. Let's keep the focus on them and stop them from destroying our country while we still can. Thank you, and I yield back.
Gentleman yields back. Is there further discussion? Ms. Hageman.
Yes, Mr. Chairman, I have an